My name is Stephanie, and today I'm going to be talking about should the U.S. implement universal healthcare? What is universal healthcare? Universal healthcare is a system that provides quality medical services to all citizens. The federal government offers it to everyone regardless of the ability to pay. Some countries mandate that everyone buy health insurance. While Obamacare had a mandate, it had too many exceptions to truly be universal. 32 countries have universal healthcare. Just an example of those countries are Australia, Croatia, Canada, Denmark, France, Germany, Greece, Iceland, Ireland, Italy, Norway, Portugal, Romania, Russia, Spain, Sweden, Switzerland, Turkey, Ukraine, and the United Kingdom. The pros of universal healthcare, the goods of having universal healthcare is that it lowers the cost of healthcare for the economy. When there is a universal healthcare system in place on a nation level, then the administrator of the plan can leverage the size of the coverage to limit the cost of doctor's visit, prescription medication, and specialist services. More people equate to an improved pricing structure that is based on the value of care given instead of the total number of services offered to the patient. Some doctors, nurses, and other industry providers earn a low salary with their work in the universal healthcare industry, but patients receive similar care without spending as much. Some medications in the universal system cost less than $10, but Americans pay over $2,000 for them because of the difference in healthcare. It will also eliminate the administrative costs. Administrative costs are built into services that doctors, nurses, and specialists provide for patients with each visit. As a patient, you are dealing with multiple levels of paperwork expense, starting with the doctor's prescriptions and ending with the insurance company's evaluation of the bill. When there is a universal system in place, then everything becomes centralized to reduce the needs to transfer the same information between different agencies. Then there is only one bill to pay. The costs for everyone goes down eventually. It will remove competition and force hospitals and doctors to provide the same service at a low cost. The system of care offers services that are expensive, which allow them to pay doctors more. Universal healthcare removes the need to be competitive for money. Competition might be healthy in most free market systems, but it is not always that way in the world of healthcare. Because funding is the top priority, medical providers target the wealthiest consumers in each community to become their patients. Then doctors have the motivation to provide as many services as possible because that is how they can earn their income. Universal systems tend to focus on the quality of the care received first. Instead of pricing products and service outside of what the average person can afford, profits are set aside for purpose of providing care as a right. That doesn't mean you won't pay each month for the service you receive, but it does mean that you'll still receive help even if you can't pay for it. Universal healthcare creates a healthier workforce. Study shows that preventative care reduces the need for expensive emergency room usage. Nearly 50% of patients in the United States went to the emergency room because they had no other place to go. That is because an emergency room is obligated by law to care for people whether they can afford it or not. They use the emergency room as a primary care physician. This healthcare inequalities is a big reason for the rising cost of medical care. Universal care also helps children to receive the care that they need. Early childhood care prevents future social costs. When children are able to get the care they require for good health, it builds a foundation for future success. We define our future success or failure as a society based on the health of our next generation. If we can reduce the issues we have with chronic health concerns, weight gain, and education access, then crime levels go down, education rates rise, and children are less likely to deal with chronic health issues as an adult. It also takes third parties out of conversation about patient care. There are insurance companies in the United States right now which must approve a medical service before a provider offers the care that their doctor recommends. This issue usually appears when there is a specialized need in the diagnostics process, such as a CAT scan or an MRI or a CT scan to confirm a diagnosis. When there is a system of universal care in place to follow, then the doctor becomes the primary administrator of the treatment plan instead. The American system does allow for patients to request a second opinion or demand to receive services outside of their insurance approvals. But if an MRI is given without the consent, then they may be able to place the cost of the service on the patient. Universal healthcare removes this problem altogether. It also provides access to healthcare instead of allowing access to it. When a society has access to universal care, then it becomes more affordable to go to the doctor. Having access by itself is not enough, which is what the free market system suggests. African American women die more frequently from heart diseases issues in the United States because they don't have the level of access to the medical care system in each community. Universal care would help solve that problem. It places healthcare as a responsibility for each community because everyone has the stake in the cost of health care. With the universal system, there is a societal desire for wellness. You will find structures and cities that encourage walking and cycling instead of driving. There are programs that encourage fitness at work. It becomes part of your responsibility to take care of yourself because visiting the doctors is an expensive expense that you and everyone else is financing. Instead of taking that approach from a family based perspective, this approach to healthcare includes everyone, no matter how much they actually pay into the system. Learning about the pros and the cons of universal healthcare and also being in the medical field and having peers, family members, friends, you know, that are sick but don't go to the doctor because, they're scared to get that bill, the $300 bill for just a simple consultation with the doctor. I don't think it's fair that, people die or don't get medication or feel sick or, can't spend time with their family just because, they're not able to afford an insurance. So for me, I personally think universal health care should be implemented in the United States.